And today I'm delighted to introduce one of our newest extension specialists to cooperative extension, Cara Cuite. But Cara is not new to extension and certainly not new to the school. Many of you may know her and perhaps have worked with her on projects that relate to food security or insecurity in one way or another. She's been with us for quite some time. She's an accomplished psychologist and really a terrific asset for cooperative extension. And today she's going to talk about food insecurity in New Brunswick.
Thank you, Larry. And thanks to everyone for being here. I'm really pleased to have the opportunity to talk about my research on food insecurity in the city of New Brunswick. Today I am going to be talking, today I am going to be talking about three separate but related projects. The first is a community food assessment and food planning project called Working Together for a Food Secure New Brunswick. The second is an evaluation of breakfast after the bell in the New Brunswick Public Schools. And the third is a survey of food insecurity among Rutgers, New Brunswick students. So what is food insecurity? I think that's an important thing to talk about before we dive into those projects. According to the USDA, food insecurity is the limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire acceptable foods in socially acceptable ways. So that's food insecurity. Being food secure is being able to get nutritionally adequate and safe foods in socially acceptable ways. Okay, so how is food security usually measured? So especially in quantitative studies with surveys, the USDA Household Food Security Survey is the measure that's used. There are different versions. There's a 6-item version, a 10-item version, an 18-item version of the scale. And it asks questions like, or it will present the statement, I was worried that my food would run out before I had money to buy more. How often is that true for you? Have you ever cut the size of your meals because you didn't have enough money to buy more? If yes, how often does that happen? Were you ever hungry and didn't eat because you didn't have enough money to buy food? And if yes, how often? So that's a sample of the types of questions that they're asking. You can see the questions are focused on having enough money to buy food. And it's important to note, and you'll see it here in some later slides, that the category of people who are food insecure is often broken down into low food security and very low food insecurity. And that very low food security group generally report things like not eating for an entire day because there wasn't money for food, losing weight because there wasn't enough money for food. So the very low food security is that group that is really struggling and has some serious repercussions of not having enough money for food. Okay, so the first project I'm going to talk about is our community food assessment and food planning project, which was called Working Together for a Food Secure New Brunswick. And this project started with Johnson & Johnson. They approached Rutgers with the idea of doing a study that would raise the bar on food security in the city of New Brunswick. And they were very open to how that would happen, but they wanted to fund a project that would do that. So they approached Rutgers, both Blaustein, the Blaustein School where Kathy Newman, my colleague, works, and then the Agricultural Experiment Station. Kathy and I joined together to lead this project, and the first thing that both of us said is if we're going to be working on issues of food security in the city of New Brunswick, we absolutely have to be working with the New Brunswick Community Food Alliance. So the Food Alliance has been around since 2010, and they work to bring people who are concerned with the food system and food security together. They recommend ways to improve the local food system in New Brunswick, and they take action to build community food security. So they have 5 work groups, and their names give you a pretty good sense of what it is that those work groups do. And they also have 2 partner organizations that focus that function essentially like work groups. the Feeding New Brunswick Network is the coalition of emergency food providers around the city. So they're not exactly work groups, but they're like work groups. So what we ended up deciding to do for the project was to first do a research component. We did that in the fall of 2015 through spring of 2016. We conducted a community food assessment. And the goal of that project was really to understand who in the city lacks food security and why. After we did that research project, we spent a lot of time presenting our findings to the Food Alliance and other people in the community who were interested in the work. And as we were presenting our findings, we were really focused on how can we use this study to change food security, to raise the bar on food security, to plan new programs or activities or things for the Food Alliance to do that would change food security across the city. So we worked with them on a food planning exercise, and in the winter of 2017, we all co-authored the New Brunswick Food System Action Plan. And since then, we've continued to work with the Food Alliance to implement the food plan in a number of different ways, mostly working within the individual work groups to help them implement the action items that they identified in the plan. So there were a lot of people who worked on this. Kathy and I were very happy and lucky to have help from a lot of other people. Here's the planning team. You might notice Larry's name on there. These folks helped us with sort of the big picture overview of what we wanted to do, how we were going to implement the project. The Community Food Advisory Committee was largely people from the community who helped us to identify our research questions, helped us to figure out how can we answer these questions, who in the city should we be speaking with, and they helped us to understand our findings and interpret our findings. And this was our research team. We had a lot of students that worked with us, a lot of really great students, graduate students and undergrads. And I do want to point out that we had 4 community researchers who worked with us. So 2 women from Lazos America Unida and 2 from Elijah's Promise. And they really were instrumental in getting us access to people that we normally would not be able to speak to as English-speaking representatives of Rutgers University. So they were able to conduct interviews in Spanish with people who are homeless, people who are not documented, people that really normally wouldn't come out and talk to Rutgers researchers. So we were lucky to have them. So the methodology that we used for the study was to first and foremost gather existing data. So we know that there are so many studies that have been done in New Brunswick, given that Rutgers is here and that there is such an interest in food security. So we wanted to make sure that we were capturing everything that had already been done and not sort of reinventing the wheel or redoing work that had already been done. And in addition to that, we conducted original research. So we had 74 interviews with community and nonprofit organization and staff, and that included 15 interviews with food pantry directors. We did 70 interviews with low-income New Brunswick residents, many of whom were food pantry clients. We did participant observation in food pantries, and then we did some work with GIS and some spatial work in the different neighborhoods, making maps and stuff like that. Okay, so very briefly, New Brunswick, and this is data based on the 2010 census, so this isn't completely accurate right now, but has over 55,000 residents. 50% of the city is Hispanic, and more than a third of the residents are immigrants. And we know that since 1990, most of the immigrants that come here are coming from Mexico. One of the things that is worth noticing is that as this graph shows, that our population is growing, and that is different than most of our peer cities across the state of New Jersey, who are largely losing population. New Brunswick continues to grow, and it's largely driven by new immigrants. And then finally, New Brunswick is unique because we do have such a large undergraduate student population that lives in the city. So in the 2010 census, they found 13,474 undergrads living in the city, most of them living right near or on Rutgers campus. Okay, so whenever I talk about this research, I always hear the question, what percentage of New Brunswick residents are food insecure? And certainly when this project started, I had that question too. It's a pretty logical question. The problem is there's not really a straightforward answer to that question. So we do know that 12.3% of households on a national level were food insecure in 2016. But when we look within the city of New Brunswick, we don't see consistent numbers. Now, this slide is a mess, and I don't want you to look at all of the information here, but what I do want to point out, let me see if I can use my pointer here. There were four studies done between 2009 and 2012. All of them were conducted, at least in part, by Rutgers. They used very different methodologies, had a lot of different features, but what they all used different questions from the Household Food Security Survey from the USDA. And usually it's recommended that you use a minimum of 6. And you can see here in these studies that in some cases they were only using one item. One study did use 5. But what I want to point out is that there was a huge range in levels of food security found across these studies. So from 13% to 52% was the range that we saw. So I don't think it's possible for us to know exactly what the level is in the city, but I think we can say that it's somewhere probably between 13% and 52%. I think we can say quite confidently that it is above the national average. And I think we can also say quite clearly that food insecurity is a concern for many residents in the city. So we don't know exactly how many, but it is a real issue for many of the residents. Okay, so getting to the question of who lacks food security and why. We did a lot of interviews, as I said, and we kept hearing the same themes over and over again. That there are a lot of food-related reasons. So issues of availability of the foods that people want, certain culturally appropriate foods, and the affordability of foods. There are issues with transportation. A lot of folks don't have cars or don't even have licenses, so it can be hard to get to the stores, which means that a lot of people end up shopping in small stores very close to their homes. People don't have a lot of time. Many people are working multiple jobs. One of the things that was really interesting to talk to residents about was the issue of having space to store and prepare food. So in the city of New Brunswick, there are a lot of families who share apartments with other families. So that if there may be a 3-bedroom apartment, and in each bedroom will be its own family with 2 parents and a number of children living in that bedroom. So as crowded as it might be for them in the bedroom, when it comes to sharing a kitchen, what that means is that people have, let's say, 1/3 of a refrigerator, 1/3 of the cabinet space in the apartment that they can use for their food for their family. And so that certainly means that people aren't buying in bulk. They're not able to store stuff. They're having to go and shop more frequently, and it can have a real impact on people's ability to prepare food. We also heard a lot about non-food related reasons. So people telling us that their income is just too low, and that includes people who work and people who don't work. So a lot of people in the city are working multiple jobs. They're often seasonal laborers, so money is not coming in on a consistent basis. And a lot of people can't work, whether it's for they're caring for children or other ill relatives, whether they have issues of addiction or homelessness, there are a lot of, or disabilities. There's a lot of reasons why people can't work. So definitely not having high enough income to afford food. And then also we heard a lot about the expenses that they're facing. So housing in New Brunswick is very expensive. The undergraduates in the city certainly contribute to the high cost of rental units in the city. People told us they had to choose between their medications, their prescription medications, and food. very often, or going to see a doctor, or being able to eat for the week. And then finally, given that we do have this large immigrant population, we heard a lot about remittances, people sending money back to their family in their home countries. And as you walk around New Brunswick, you see many, many storefronts that have Western Union or other remittance companies that will transfer money. You see it not just in grocery stores, cell phone stores, hair salons. A lot of different stores provide the service because so many people in the city are sending money back on such a regular basis. So where do people in New Brunswick get food? There are at least 81 food stores now, and let me back up and say, again, we conducted this research in 2016, and pretty much the minute you finish a map like this, it pretty much automatically becomes outdated because some stores have closed, other stores have opened, but at the time that we did this work, there were 81 stores in the city, 52 corner stores, and 4 large supermarkets, and you can see that they're pretty well concentrated in the middle of the city. People also get food at the New Brunswick Community Farmers Market, which hopefully most of you know about because it is a Rutgers program. There are over 20 community gardens and school gardens around the city. There are 2 soup kitchens. Elijah's Promise is one of them. School feeding programs. There are senior feeding programs, including Meals on Wheels. So there are a lot of other programs out there that people use to get food. To get food. And there are over 20 food pantries around the city. Here's a map, and you can see that where those food pantries are is pretty consistent with where the grocery stores are. So they're also centered in that middle part of the city. And this is another number that's constantly changing. The last I heard, there were 25 food pantries in the city. Unfortunately, that's a number that seems to just go up and never really goes down. And there are some different types of pantries that we have. So some participate in federal and state programs. Those pantries tend to be the larger pantries in the city. They also tend to require, well, they have to require, if they are in the federal and state food programs, a lot of paperwork from the clients that use the pantry. There are a number of people in the city who are not willing to or feel that they can't fill out paperwork to get food. So there are other smaller pantries that largely get their food from the county food bank. And that doesn't require any kind of paperwork or identification or anything. Many of the schools have their own pantries. They generally only serve the students and their families. And the text got a little messed up, but Rutgers has now joined the ranks of having food pantries for their students, and I'll talk about that a little bit more later. So when we were speaking that the residents that use food pantries as well as the food pantry directors, we heard from pretty much everyone that pantry clients are using multiple pantries. So they're going and kind of shopping to get different ingredients and going to different pantries to get enough food to feed themselves and their families. So there are some pantries that provide a lot of meat. For example, Emmanuel Lutheran has a relationship with the local grocery store, and they have a lot of meat. Some food pantries, like the Bayard Street Pantry, has a lot of breads and cakes because they have a relationship with a bakery. So people will go from one to another to get the things that they need. Another big issue that a lot of the pantries are facing is the idea of being a choice pantry where people can come in and pick the food that they want versus just bagging up food for your clients and giving everyone essentially the same food in the same bag. So that is something that came up both from the clients and from the people running the pantries, that they would like to be able to offer more choice to their clients, but that mostly it's a consideration of space, that they don't have enough room for people to come in and pick what they want, that it's just much easier for them to bag it up and hand it out. We heard a lot about the difficulties with the pantries are all experimenting and trying to get fresh produce to their clients. A lot of them don't have refrigerated storage, so it becomes a real challenge. Also, often the food that is given to them is sometimes given to them because it's very ripe, and so if the food pantry receives a large shipment of some kind of very ripe produce, it's sometimes not easy for them to turn around and get clients. And if it's not a day that they're normally open, that they receive the produce, it can be a real logistical challenge to get it out to people before it's not really good anymore. So, well, we heard from people that they were very appreciative of the food, but that they wanted more fresh food and more choice in the food that they receive. And finally, a lot of the pantries try to provide some kind of social services in their pantries when they can. It's usually on an inconsistent basis, occasionally even trying to have some kind of health care or mental health. So because they know that a lot of the clients that are coming to them are not really engaging in the system in other ways. So often that pantry visit is their only contact with someone in the city who might be able to connect them to those types of important social services. So many pantry directors brought that up as an issue. Okay, so I just am going to give you one example of how our community food assessment, that research component, really connected to the food planning activities that were going on in the city of New Brunswick. So the Feeding New Brunswick network came up with its own action items for the food plan. And one of those action items was to explore the creation of a centralized choice food pantry. So, and these are their words that I have here on the slide. Client choice pantries afford patrons a higher degree of dignity, and it can eliminate some food waste. And we do know, and we heard over and over again, that often when people get bags of produce, what they'll do is just, as they're leaving the pantry, take out the things that they don't want. Some pantries will have a table where people can put the food that they don't want, but sometimes you'll see it for blocks, cans of cranberry sauce or, other foods that people don't really want. You can just see them as people walk away. Their bags are heavy. They think, well, I'm not going to eat this anyway. Let me just get rid of it so I don't have to carry it all the way home. And so that's something that everyone involved wants to avoid. They'd much rather not waste the food and give people the food that they actually want to eat. And a large-scale client choice pantry could also help to provide those social services and those other resources as a one-stop shop for clients. So recognizing that if they had an appropriate space, they could have a large choice pantry that also provides those other services. So that is one of the items in the Feeding New Brunswick Network's food action plan that they put in. And I have an update, which is that they are in the process of creating what they're calling the Choice Pantry and Resource Center. So they've been working with Keith Jones in the city government, and they are moving forward with a partnership to create a large centralized pantry. So the city is at this point hoping to be able to provide space for the pantry, and it would also include a health clinic with mental health services and other social services. This would be able to solve some of the problems of being able to serve more fresh produce, as they would have refrigeration there, and it would also be much more likely to be open every day so that any delivery that came in could be distributed immediately. The choice means that clients could be a lot more like shoppers rather than food pantry clients just receiving a bag of food that they may not want. The county food bank is leading this along with two of the larger pantries in the city. And it is worth noting that there is still some resistance from individual pantries. So not all the pantries are on board with this. They don't all think it's a good idea. And that's fine, because the idea isn't to only have one pantry. The idea is to have one large pantry with a lot of other resources there, but to also have some of the smaller pantries around the city still there, so that people who don't have transportation to the large pantry or might not want to use the large pantry still have other options. I was at this month's Feeding New Brunswick Network meeting, they asked me to come in and to kind of share again the findings from the food assessment to help them to use that as they're planning this choice pantry and remind them of some of the findings. So it's been exciting to see them move forward with this project and to know that it was connected to the research that we did. Okay, so another work group is the Healthy Food Access Work Group, and one of the action items that they had was to evaluate the Breakfast After the Bell program in the New Brunswick public schools. So this program was one of the original projects of the Healthy Food Access Work Group that they had advocated to get this program implemented in the schools. They highlighted that it's important because there's a significant number of New Brunswick residents in the public schools. About 1 in 5 residents is a student in the schools. The school food program is one of the largest feeding programs, if not the largest feeding program in the city. And so city employees, school board members, and alliance members requested an evaluation of how well this Breakfast After the Bell program is working. So Jennifer Shkaitis, who I don't see the list of who's on, but I think she may be on the call. She and I wrote a grant in cooperation with the New Brunswick Public Schools Board of Education to the Office of University Community Partnerships, and we got a grant to do this evaluation. We have been very fortunate to have some great students that have been working with us on the project. And so why do we care about school breakfast? Why is it something that people are interested in knowing if it's working or not? Well, first of all, as I said, school feeding is a really important tool in addressing food insecurity in children. There is evidence that breakfast can improve on-task behavior and cognitive functioning, at least in the short term, and there are suggestions that it can improve grades, although those data are really not as strong as people might like them to be. And studies have shown that serving breakfast in school can increase attendance and decrease tardiness. So that's just breakfast in general, not necessarily breakfast after the bell. Breakfast After the Bell is a program that there are different versions of it, but in all of them, breakfast is served to students after the first bell of the day has rung. So it's during class time that students are eating. In the city of New Brunswick, they were using a breakfast in the classroom model, which means that bags of food are brought up into each individual classroom. The students walk up to the front of their classroom, they take the breakfast that they want, they go back to their desk where they sit down and eat it. And here is an image of the mayor of New Brunswick, Jim Cahill, eating breakfast with the public school students. So in terms of the effects of breakfast after the bell, there are far fewer studies. It's a newer concept, and there's just not great research out there. However, if you look at the New Jersey Center for Food Action website, they say there is ample evidence of the effectiveness of breakfast after the bell in districts across New Jersey. Districts that have switched from offering breakfast before school to serving breakfast after the bell report the same results. Participation soars, students are ready to concentrate and learn, there are fewer trips to the school nurse, fewer classroom disruptions, attendance improves. I did email this group and ask them where that evidence is from, and I was told by one person, I didn't get a response back, but I was told by someone who works with them that it's almost certainly anecdotal evidence that this is based on. So, but there's a big push to implement breakfast after the bell across New Jersey, and this is the type of reasoning that is used to say that it's so important. Oh, so I also, so I wanted to just also say that one group that has been really instrumental in pushing breakfast after the bell across the state of New Jersey is the Advocates for Children of New Jersey, and they do an annual report where they count how many students are receiving breakfast in districts all across the state. And so they've been doing that, I think, for 7 years. And so a lot of the schools pay attention to that because it ranks them and it calls out schools with poor performance as the school breakfast underachievers, and it's they're really trying to push this program. So in terms of our evaluation methods, we use a multi-method approach. So we conducted interviews with staff members, we conducted observations in a number of the different schools, we conducted a parent survey, we did focus groups with K through 8 students, we did a paper survey with middle school students, we conducted an online teacher survey, and we also received quantitative data from the schools, including data on attendance, tardiness, and disciplinary actions. I want to point out that this program is only in the K through 8 schools. There is no breakfast after the bell in the high schools. And for this study, in terms of our evaluation, we were not looking at all at any kind of nutritional analysis of the food that's served. So the USDA has really strict guidelines. We have no reason to think that the New Brunswick Public Schools are not adhering to those guidelines, so we weren't looking at that at all. We also weren't looking at nutritional outcomes or any kinds of health outcomes at all for this study. So the breakfast after the bell timeline in New Brunswick is that between 2012 and 2014, the Advocates for Children of New Jersey was doing a lot of advocacy statewide, but also in New Brunswick, and the New Brunswick Community Food Alliance was conducting some advocacy work as well. We had originally been told that that the rollout happened in September of 2014, that all the schools implemented breakfast after the bell pretty much at the same time. But once we started looking at the data, we saw that, in fact, there was a very slow rollout over the beginning in September of 2013 through September 2014. And part of why we were given originally not told accurate information is that the food service provider has changed since that time. It's actually now changed twice, as I'll talk about. But so the company that was providing the breakfast was not still in the school, so we weren't able to talk to them. Okay, in the fall of 2014, New Brunswick received community eligibility, and what that means is that every student in the district receives free breakfast and free lunch regardless of their ability to pay. And it's basically because so many of the students would qualify for free and reduced price lunch, and many students don't get it because their parents either can't or won't do the paperwork, that they find it's just better to just provide free food for everyone, don't ask anyone to fill out the paperwork. And so that happened in fall of 2014 in New Brunswick. So breakfast was fully implemented breakfast after the bell was fully implemented in the K through 8 schools at that point. Our evaluation was supposed to be from July 2016 through July 2017, although it's continuing, and I can talk about why. In January 2017, it turns out that the middle school unexpectedly ended breakfast after the bell. So mid evaluation, the middle school changed the program, which is interesting and opens up some interesting research opportunities, but it also means that we have to look at middle school data separately from any of the other schools. And now I'm giving away our findings a little bit, but just to provide an overview of what's going on. In September of 2017, the district chose a new vendor, and that is in part because of some of the findings that we've been sharing with them. And I should say we've been working with the district all along, asking them, showing them what we're finding, asking them to help us interpret it, and they're giving us new research questions. So it's been a really great relationship working with them, and it was great that we felt like they were using some of the study in their decision making, but I'll talk a little bit more about that. Okay, so this is just an overview of when we did the work that we did. Again, originally we were hoping to end in the spring of 2017, but you might notice here it wasn't until November of 2017 that we actually received the data about attendance tardiness and disciplinary actions, and it's a lot of data, so we are still running the analyses on those, but it was much later than we had anticipated. In addition, just this month, we did the survey, the paper and pencil survey of students in the middle school at the request of the middle school principal, who has been seeing a decline, and that's something also I'm going to talk about. But they asked us to come in and continue the research project. And then this spring, we're going to be working with the district to present the findings to school staff, teachers, and parents. Okay, so what is served for breakfast and breakfast after the bell? And again, these pictures and the interviews and the things that we did were done before September 2017 when they had a new food service provider. So I can't say that these are representative of how breakfast is now, and I know that they are implementing some changes with the new food service provider, but this is how it was for the first many years that they had the program. So each child would get one of these packs. 3 days a week, the pack included a box of cereal. 1 day a week it had a muffin, and 1 day a week it had like an oatmeal bar. In addition to that, they would have a juice pack, and that juice counts as their fruit. So breakfast is required to contain a fruit. That 100% juice pack counts as that fruit. And you can sort of see in the back here, let me see if I can make the back here, I don't know if I can do that. I'm trying to just use my pointer. You can see that there's this 100 calorie pack. They had little snack cookies or snack crackers that would also be included. So those were the 3 components of every breakfast pack that the students would get. And you might notice that that's a Trix cereal, and you might think, how on earth could that possibly meet the USDA standards? But it does, because it's specially formulated Trix. You can see on there it says some percentage less sugar. It does have some whole grains. So this is not the Trix that you would buy in the store, but it's Trix specific to the schools. And we also saw Cocoa Puffs and brands that you would recognize, but they don't taste the way you would expect them to necessarily. So they also came up with milk and fresh fruit. Okay, so what are the effects of breakfast after the bell? What did we find? First of all, we did find that participation increased dramatically. So you can see here, these are the years before breakfast after the bell. To the left, that shaded area is that slow rollout that we talked about, and you can see that gradually participation was increasing as more and more schools came online with breakfast after the bell. And then if you look to the right, you can see, oops, wait, I didn't mean to do that, sorry. You can see that higher participation rate that was pretty well sustained. I'm sorry, I'm trying to clear I can't really see my slides right now, but so you can see that it's pretty well sustained, although there is a drop off, especially after 2016. But again, I can't see that. Okay, I'm going to go to the next slide. Maybe I'll see it better. So here are those participation data broken out by elementary school and middle school. You see that rise, and you can see that the drop off is happening more in the middle school than in the elementary school. Wait, can I pop out your little window with your face on it? I'm sorry. I have no idea how to do that. Yeah, I don't know how to do that. Sorry. Okay. So you also might recall that I said that the middle school stopped serving breakfast after the bell, but we don't see a drop off in their numbers through May of 17, although I'm quite confident that starting in September of 17, that they did have a drop-off, and if there's time for questions after, I'll be happy to talk about what was going on in the middle school there. Okay, so one of the things that was interesting that happened during this project is that not only do we see that drop-off in New Brunswick, but this was happening around the state. So they saw a 2% decrease from 2016 to 2017 around the state, and specifically in those very low-income schools, they saw a 5% drop-off. And New Brunswick is included in there, and New Brunswick had one of the biggest drop-offs with a 16% drop-off between 2016 and 2017. So now the school's very interested, because this is coming out in this report, as to why their numbers are dropping, and Advocates for Children of New Jersey and the Anti-Hunger Coalition of New Jersey are knocking on the door of the school district saying, why is this happening? So we feel like the timing of our study was really good in that we can help to answer this question. So one other thing, and I'm just seeing time, so I'm going to kind of rush or do this relatively quickly. And something that was unfortunate is that there is no way to track the fresh fruit that gets delivered or the milk that gets delivered along with the meals. So there's tremendous variability across the classrooms, particularly with the fruit, and the school is not tracking that. What we were hearing from the staff is that the nurses said that there were fewer hunger-related visits, but they don't track those, so that wasn't something that we could quantitatively assess. Staff told us repeatedly they just don't think the food is good quality or that there's enough variety, but they were surprised that things like mess and spills were not as bad as they had originally expected that they would. Parents are telling us that they're more likely to be on time, that their children are more likely to be on time, that they have easier morning routines, that their children are less hungry, that they've saved money. So the parents are seeing some benefits from this, although the parents also said that they thought the quality and variety could be better. 78.6% of the teachers said that they liked the program and thought it should be continued. More than half, like all aspects of the program that we asked about, with the exception of the quality of the food, the healthfulness of the food, and the variety of the food, they really felt that that was lacking. Very few approved of those three program aspects. The students told us that a lot of times they take the breakfast pack and don't actually eat it during breakfast. That was a very surprising finding. Or that they'll only eat some of it. They drink the juice and throw the rest away. Or they'll just take the little cookie pack and save that for later. What we heard across all of the ages and all of the schools with all of the focus groups that we did was that the students are sick of the food that they are being served. Our analyses of the effects of attendance and tardiness are ongoing because we did get that data relatively recently. Some of the recommendations that we had provided to the school district were that they needed to look to other vendors for increased variety and healthfulness of the food choices, and we were pleased to see that happened in the fall of 2017. They did go with a new vendor. And that vendor is now serving hot breakfast at least a few days per week, and they are experimenting with different approaches. For example, using kiosks in the classrooms, in the hallways where kids can pick up breakfast and things like that. So we're interested to see how that affects participation. We suggested that they have the teachers with the highest proportion of students who participate in breakfast and the fresh fruit program to share ideas like in a peer-to-peer kind of education approach, and the district leadership is interested in moving forward with this, and Jen and I met with them earlier this month to talk about how to implement that. And they also are committing to re-engaging the community about the importance of breakfast. And that was based on the meeting that Jen and I attended with folks from the Anti-Hunger Coalition and from the city who are saying, you know, these numbers are falling and it's important to get them up. So we're really pleased to be able to participate in that outreach campaign. Okay, so we just talked about a large percentage of the population, which is the K through 12 student body, but we also discussed how there are so many Rutgers undergraduates who are living in New Brunswick, and we know that this is a group for whom food insecurity is an issue, although it had not really been studied. So we know that there are websites and Facebook pages that students use to tell each other where there's free food. We know that the issue of food insecurity came up during that community food assessment. People in the city at food pantries in the city were telling us, boy, we're seeing a lot more Rutgers students coming and using our food pantry. We know that there are programs on campus, including academic affairs and student affairs, who were supporting students with grocery store cards and things like that. And we know that a food pantry in spring of 2016 was created on campus by the Office of Off-Campus Living and Community Partnerships, and that the number of students using that has been growing every semester since it opened. And this is not unique to Rutgers at all. There are almost 600 campuses that have food pantries, and that number is constantly growing. The last time I used this slide, it was, I think, 400, and I looked this week to update the number, and it's now 600. So it's really growing quickly. A study that was released in last winter, about a year ago, that looked at 33,000 community college students in 24 states, found 56% of those community college students were food insecure, with 33% having very low food security. Looking at studies of other four-year universities, we've seen a range from 14% to 59% of students being food insecure. So there's a real range, and actually I think that 59% includes community colleges also. So there's a range, but this is an issue that's increasingly being discussed and increasingly being studied. We decided to do a survey here on campus. I worked with, I should point out, especially Steph Brescia. She's a grad student in the GSE. She's been doing a lot of work on this. We also partnered with the Office of Institutional Research and Academic Planning and Student Affairs to work on this. So we conducted the survey in 2016. And I'm just going to speed through some of this, but we got a good response rate. We had over 8,000 responses, students who participated. We got some of their data from Rutgers because they signed in with their RUID, and it's a representative sample. So there are only very minor or small differences, and the data are not weighted because of that. So we use the USDA measurement tool, and we use some other questions specific to Rutgers, and this is what we found. We found among undergraduate students, when we add that low food security and very low food security, we found that 36.9% of Rutgers, New Brunswick undergraduates are food insecure, and a lower but still significant number of graduate students, 32.1%, are food insecure. We found that undergraduate students who live off campus are more likely to be food insecure, and then probably not surprisingly that those without a meal plan are significantly more likely to be food insecure, although still 29.4% of students with meal plans did report being food insecure, and that has a lot to do with the fact that just because you have a meal plan doesn't mean you have every meal covered. There's a real range in the meal plans that are available. We found that it was related to, that food insecurity was related to GPA. The higher the lower the food security you have, the lower your GPA on average. This was true for graduate and undergraduate, but much more pronounced, a much stronger effect among the undergraduate students. We found that Black and Hispanic students were more likely to be food insecure. This is undergrads. If your parents had lower levels of education, you were more likely to be food insecure. Those with Pell Grants were more likely to be food insecure. Those who didn't receive financial support for their families, and those who have jobs other than work study were more likely to be food insecure. 5.6% of all students report using a food pantry. Most of them were going off campus. We hope that will change. We had a number of recommendations here, but I will just say one of the main ones was to work with other colleges around the state. And we did share our instrument. Drew University has done a study. Rowan has done a study using our instrument as a basis. Caldwell and TCNJ may also do that. And we had suggested to have a meeting, a statewide meeting, which we did have in January of this year. At that meeting, we created a research working group that we've been emailing about doing research around the state, and we're planning to hold the meeting again next year. I should say we are planning to do our survey again in the future, probably in the fall of 2019. And then I just wanted to close with this quote. the community at Rutgers is very supportive. When I need a meal, and I can't actually read my own slides here, but basically we take care of each other is what I can read there. And that is sort of what we're hearing from a lot of the students. I wanted to thank my many collaborators on the different projects, and that's my contact information, and I would be happy to take any questions that you may have.
Thank you, Cara.
You're
so
welcome.
Let's open this interesting and I think problematic issue up to conversation. It just boggles my mind sometimes to think that in year 2018 that hunger is as pervasive as it is, and then to see it in the college campuses even drives it home stronger to us. I take for granted every time I eat, and I shouldn't.
Yep. Yep.
Questions? Jennifer has been on the webinar, so I'm glad that she had a chance to. So here's a text that just came in.
Okay.
You see it?
Right. So Aaron was asking how the Governor Murphy's announcement of the massive redevelopment project for New Brunswick and trying to make New Brunswick a tech innovation hub might affect food insecurity in New Jersey. So I think if it works out the way that he wants it to, we'll end up with more higher income residents in New Brunswick, for sure. And I think that there could be some unintended consequences of that. I don't know that the people who are currently food insecure would benefit necessarily from that. Oh, now I see the rest of it. Yeah, that's what he said. Wouldn't it displace lower income residents? Yeah. So that's exactly what I was going to say, which is that rents will go up even more, and we hear from many people that they can't afford apartments. As I talked about, we see multiple families sharing apartments. So if we had more higher income people moving to the city for those higher paid jobs, I think for sure it could have a negative impact on a lot of the people who are most at risk for food insecurity in the city. I mean, I would love to say that it would mean more jobs for them, and in some cases, hopefully it will. But I think overall, it could have a real impact, mostly via the housing market. I would think so. So it could be a problem. Yeah, and Barb wrote in just that there are so many financially fragile households in New Jersey with volatile income and high expenses. Yeah, and that is absolutely what we were hearing as we talked to people, that they just they're making decisions about, should I buy my medicine or should I buy food? And I should also say that when we did the student survey, we asked a question about, have you ever had to choose between educational expenses like buying books and buying food? And I don't have the number off the top of my head, but a fair number of them said yes. That is something that they're having to make that decision about. I'm not buying a book for this class. I'll just borrow my friends so that I can afford to eat. And then someone asked if I've done any work in Camden. There's a great report called Cultivating Camden, the city's food economy strategy. No, I haven't. And yes, there are a lot of really great community food assessments that have been done around the country, and with some of them tied to that food planning work that we did here in New Brunswick. And we've looked at them and often modeled the work that we did based on other similar cities. One that was particularly strong was one that was done in Poughkeepsie. That was really well done. I'll have to look again at the one in Camden, but yeah, this is something that's happening around, everywhere. That cities are looking at it, looking at this issue and trying to identify solutions to some of these problems. And looking at it not just with that USDA measurement of X% are food insecurity, trying to look at it in the way that we did in our study in a more qualitative way to understand the issues a little bit more deeply. All right, well, I don't see any other questions. I'm looking through. I don't see any other questions.
I don't see any others coming in either. Cara, I want to thank you for a very thought-provoking webinar today. And I think, and I hope that all of us have, and I know all of us have learned from this, and I hope all of us come away from this thinking about ways that we can contribute solutions as the land-grant university. So thank you so much. Thank you to all the participants. We appreciate your logging in. There's lots of thank yous coming in on the text message board, as it often does, so that's nice to see. Cara, we appreciate this. To the rest of you, let me just say thank you for participating, and we shall see you at next month's webinar, and we'll announce ahead of time what that topic will be. So again, thank you all, and have a lovely weekend, and we'll see you soon.
Thanks, Larry.